Class 3, we talked about the predictability of the aligners in distalizing the lower arch. To achieve a perfect lower distalization, we have to take into consideration several factors. These are the position of the distal tooth. If we have the wisdom tooth present, obviously we will have to extract it in most of the cases and get advantage of the regional acceleratory phenomenon. Since after extraction, bone remodeling will increase the speed of the distalization of the second molars. In case we don't have this lower wisdom teeth, as the case we're seeing in the screen, it is more predictable the situation, the distalization in the fourth quadrant than in the third one, especially because the crown of the 47 is mesially displaced. This means that the distalization will occur just by straightening the crown, just by moving the crown. We don't need a bodily movement as we almost need in tooth 37, which is almost straight. Nevertheless, in both of these cases, 2 point something millimeters, which is the average as stated in the literature as predictable for clear aligners, is highly predictable. But we don't have to forget that usually we measure patients in 2 dimensions. These are transversal and sagittal, but sometimes whenever we're talking about this transversal dimension, we forget that the dimension of the bone in the posterior segment is important. For this, we usually need a CBCT. Take a look in this case. We need some expansion in the posterior segment because at the very beginning, even considering there is a space from a sagittal perspective, if we're talking about the transversal dimension, we need some expansion. Otherwise, if we plan pure distalization in this position without expansion, see the pattern, it is distalizing and it is expanding, probably there will be an impaction of the root of the lower second molars into the bone, and this is something we have to avoid. So remember, in these distalization cases, what we have to do is expand and ensure there is no impaction. So this means we're moving the tooth along the spongeous bone in the lower arch, which makes it much more predictable.